Nice to see you all. And Carl, thanks for coming. As you guys can guess, the question I usually ask Carl when I first see him is, what car did you bring today? He always brings something interesting, so thank you for coming in. Today, guys, we're going to talk a bit about some of the work we've been doing related to lived experiences with technology in older adults. There are no disclosures that I have relevant to the activity that we're going to talk through today. And just a few objectives, really. One is to describe how technology use in older adults has evolved since the beginning of the COVID-19 pandemic, recognize what makes technology experiences successful and not successful in those with cognitive decline, and then look at the role of caregivers in the above. So starting with some of the changes that have happened. Back in 2022, I was lucky enough to be part of an accelerator program called the Age Tech Collaborative with AARP. And that organization really is sort of at the forefront of collecting information from a technology standpoint on how older adults are engaging and using technology. And through that program, you get connected to decades of proprietary consumer research related to Americans that are 50 years and older, and it really offers an opportunity to look through that data rather than try to reinvent the wheel. They've already collected a lot of it. And then following the accelerator, you get to remain connected to age tech investors, pilot opportunities, industry leaders, and like-minded innovators. But doing that work and being part of that program, I really came to appreciate AARP as an organization and have started actually using their research more often than not when I'm putting together these types of presentations or even thinking about where are the gaps that currently exist. So I want us to look at the first report that AARP put out there after the start of the COVID-19 pandemic. It was published in 2021, and it was looking at technology trends in Americans 50 years and older. And there are a few key themes that were identified, and part of what I like about their work is they try to keep it as clear as possible, and they try to stay focused on themes that are relevant to current society. So one striking thing was that spending in technology during the start of the pandemic, looking at those 50 years and older, increased by 190%. So 2019, you're looking at around $400 spending in technology. Pandemic starts and you jump up to over $1,100. Now, granted, that's barely enough to buy an iPhone, but nonetheless, it means that there were significant technology upgrades happening in this group of people. They were also doing more with smartphones, and relevant to us, a key theme that pops out even when you are doing this at the general population level is that they were using smartphones to communicate with medical professionals, and certainly that hasn't stopped through this day. And then interestingly, smart TVs were the number 2 thing that these individuals were purchasing, largely because they were consuming different multimedia sources. And then Bluetooth headsets was number 3. And the reason I highlight that is with the work that I do taking care of older adults, being able to hear and being able to communicate is a major thing in the clinic visits that we have. And so it's not overly surprising that one of the things older adults really invested in was the ability to actually have these headsets that they could better hear and better communicate with their providers. And this, with Carl, this comes up, he always uses a headset when we talk. It comes up with my patients every single week that if they can't hear the conversation, that is one major thing that makes a virtual visit difficult. The actual experience can be quite good, but if you can't hear and communicate, it's a major problem. And older adults were more likely to blend their consumption of entertainment. So rather than getting rid of cable like so many younger people do, they would hang on to cable but start using streaming services. So looking at some of the actual numbers, if you look at smartphone ownership rates, in 2020, you're starting to get close to the rates of younger individuals. The lighter blue line here is people 18 to 49. The darker blue line is individuals 50 and older. And not quite on parity, but getting close to the ownership rates of younger individuals. And perhaps not surprisingly, if you break that down by age ranges, if you look at individuals in the 70-plus age group, they were lagging behind a little bit. So as age went up, you were more likely to making that transition to using a smart device. So the trends aren't new, they're just accelerated. If you look at the trends, this has been going on for a long time, but this accelerated things. But there were still major concerns that remained when they did this questioning. So one was a lack of knowledge was still felt to be a barrier. Privacy concerns were still a barrier that really hasn't changed through today. And then there was this increasing gap between those that do and do not use technology. So when questioned, 60% of people reported barriers to having access to high-speed internet. That's a significant number of people when we're talking about having a solid connection, for example, for doing a telemedicine visit. And 15% of respondents reported that they had no access to internet. Again, this is looking at older individuals. Age group, but 15% may not sound like a lot of people, but it really is. I mean, that's a big number of individuals that don't have access to some of the more recent technology services. And then I added this slide in because it really focuses on how are these individuals learning to use technology. Dr. Potash mentioned that in his conversation with Carl earlier, but also it's one thing that when I dive into some of the work that we've done with focus groups on older individuals, it really is who of my friend group or who in the family is potentially going to help me learn this. Older individuals are way less likely to pick something up and just play around with it until they figure it out, which is certainly the approach that a lot of younger individuals take. So now switching to their 2024 data. So this was published recently, and it's taking a look at what are the trends today. Now, 50-plus ownership of most primary tech devices is on parity, and I'll show you some of those percentages. Smart home and home safety technology adoption rates are flat. One of the reasons that I highlight this is I'm going to talk in a few minutes about work that we've done with Amazon, and they are, with their Alexa devices, very interested in why are these adoption rates flat and what can we do about it for them to improve sales, but for those of us to do this work because there's a potential that it can actually help the functioning of the people that we take care of. Also, technology's role in wellness and healthy aging is starting to be more and more recognized. When they surveyed individuals, this was one of the primary things they mentioned using their smart devices for outside of things like routine communication. In general, the older population has a wait-and-see approach to new technology. That doesn't mean they're not interested. They might just wait for other people to adopt it first. So they're not going to be running out and buying an Apple Vision Pro anytime soon. They're going to wait and see how does that technology get picked up by the masses. And then there's also this concern, which is actually getting worse, not better, that technology is not designed with age in mind. And we're going to look at some of the percentages for that as well. So looking at the things being on parity. So there's a couple interesting things to me about the smartphone ownership rates. One is the older adult rates have gone up, but the second is, even though it's a small percentage, the ownership rate in younger individuals has actually gone down. Now, that could be a variation that's just occurring in their sampling that they're doing, but nonetheless, it's significant and interesting, and there is a movement in some individuals, especially younger individuals, to move away from this reliance on technology, and it'll be interesting to see, is that a trend that becomes more noticeable. You also see the smart TVs and tablet use on par with what older individuals have, and then when you start getting into things like wearables, you get more of a gap, although more and more of our patients are moving towards using those devices as well. And again, that smart home technology usage compared to other technologies relatively low in both age groups. So this breaks down the smartphone ownership. So you see that all the groups are starting to get pretty close together, even the 70-plus age group. Still lagging a little bit, but starting to get into those high 80s, low 90s percentages in terms of ownership rates. And then when you look at the smart home technology adoption rates, again, relatively flat in comparison. Despite new companies coming out, more cost-effective alternatives coming out, adoption rates have still been relatively flat. And when you ask the question of, why might that be, largely people say they don't feel like it's needed, it's too expensive, they have other easier, older techniques that they utilize that they don't see a need for it, or they're not interested, or there's these concerns about privacy and whether or not using the devices is secure, and that is a trend that has not gone away either. So looking at this question of, is technology designed with age in mind? And you start seeing sort of a trend in the opposite direction, that as you're looking at older individuals, more likely to feel like it's really not designed with them in mind. Those in the 70-plus age group, the most likely to feel that way. And an important thing that got highlighted in the research itself is that this is not improving. It's not going in a direction that older individuals feel like they're involved. They don't feel like they're the ones that are driving any of the decisions. And this is an important thing that has gotten back to the large tech companies, and they're starting to consider more how they potentially can make amends for that. So I wanted to just take a quick pause before I jump into some of our actual work, just to really focus on the population that we treat. So this was an editorial that I put together with Deirdre Johnston before she left Hopkins, and really in the article what we're focused on is, if you look at the population of older adults with mental health concerns, what do the trends look like in that group? And they really are less likely to have access to good, high-quality internet. They're less likely to be people that have transitioned to the use of smartphones. And truly, there's a decent number of them that have no access to internet whatsoever, or let's say it's available at their housing facility, they may not have any idea of how to use it. And the reason why it's so important to recognize that is, with so many older adults having the improvement in their access, you have an even greater risk of individuals being left behind. So it's almost a worse place for some of these folks than if nobody were using the technology. They're really getting left behind. And if you look at the telemedicine usage rates in our department, and you look at providers that take care of that older adult population, you see a lot more telephone visits, a lot fewer smartphone visits. So these trends really play out in our own data. So let me talk a bit about one of the studies that we conducted, sort of what the idea was behind it and some of the results from it. So we're going to look at what makes technology experiences successful and not successful in those with cognitive decline. So I did want to make sure that I highlighted that technology in this context, it's largely, and this came up in the focus groups, people largely focused in on smart devices as opposed to technology broadly, which could be pretty much anything these days. But a smart device, defining it, is a wired or wireless, context-aware electronic device capable of performing autonomous computing and connecting to other devices for data exchange. So breaking down a little bit of that, so context-aware, meaning it's able to collect information about the environment. So let's take a smart home thermostat, for example, having a temperature sensor in it that it knows what the temperature is in a room, and it's able to sense when that temperature has dropped. The autonomous computing side of things, once it senses that has dropped, it's able to take an action, such as turning on your furnace. And then there needs to be this connectivity for data exchange. So if we take like the Google Nest, for example, it is going to be connected to Google's data network, and then from there out to the internet more broadly. So we had this really interesting opportunity to collaborate with both Amazon as well as the University of Queensland, which is in Australia. And it arose out of this mutual interest in the utility of smart devices in older adults with cognitive decline. I spontaneously, randomly reached out to the Hopkins AWS, which is Amazon Web Services representative. That person was aware of ongoing work at the University of Queensland relevant to older adults with cognitive decline. And we put this collaboration together with the AWS Solution Architects, Hopkins Medicine, and then the University of Queensland Human-Centered Computing and Interaction Design Group. So those were largely a group of engineers and individuals focused on human factors and understanding how we interact with things like technology. When we started the project, there was parallel data collection at 2 sites. So we did our Zoom sessions from out at Johns Hopkins Bayview Medical Center, and they obviously did theirs at the University of Queensland in Australia. And to start this collaboration, the aim was really an initial explanation of technology experiences in people living with cognitive decline in their care partners. And the folks at University of Queensland have all these fancy terms for things. They called this a living experience expert reference group that we were utilizing. And then an interpretive description approach, again, a term from them. So really, how can we elicit key shared aspects of lived experiences that can help inform clinical practice and technology design? So when we recruited folks for the study, it was individuals with cognitive decline, so we used the clinical dementia rating scale. The score was 0.5 to 2, so mild cognitive impairment to moderate dementia. They must be able to consent and participate in the focus group session. We didn't want to be in a scenario where someone was on the focus group and not able to participate. It makes people feel pretty badly when that's the case. We also recruited a care partner for each individual. That could be formal, like somebody hired by an agency, or informal, like a family member. They had to be over the age of 18. And then each study dyad, so the combination of a patient with cognitive decline and a care provider, did a scripted, semi-structured focus group. We did these by Zoom, and they lasted less than or equal to 90 minutes. There were 2 dyads, so 2 people with cognitive decline and 2 people that were care providers per focus group. And Carl and his wife actually participated in one of them. So looking at who we ended up getting as part of the study, we got 17 individuals with dementia. 71% of them were male. Average age of 71 years. These are medians with the range listed afterwards. Most common diagnosis was Alzheimer's dementia, followed by mild cognitive impairment. The CDR average was 1, which would be a mild dementia, and they were about 4 years since diagnosis, with a pretty broad range on that one, anywhere from 1 year to 16 years since being diagnosed, and the vast majority of them were living in the community. On the care partner side, 82% female, average age of 67.5, and in terms of how long the focus groups actually took, it was a median of 71 minutes, with the longest one being 84 minutes in duration. As we conducted these focus groups, we did about 10 of them total here. The audio recordings were transcribed using automated transcription, and then one of our students, Jacob Shaw, took the time to go through and do manual verification and de-identification. And then the University of Queensland group largely led the initial coding, and some of the themes that they came out with, and we're going to walk through a few of these. There was a continuum between positive and negative encounters with technology, and usually as people would talk about it, it would be a momentary interaction. So they would actually describe the interaction that either led to them thinking more positively or negatively. There was a context to every technology encounter, which may seem obvious, but when individuals were actually describing their experiences, they often did relay the context. They highlighted strategies to support technology use. And when we asked them, sort of as a last question, if they had suggestions for improving technologies, they all had suggestions. You just had to ask them. So that was something that we reported back to the Amazon group was, hey, you just gotta ask, get a group of people together and talk with them about it. When it comes to positive technology encounters, technology can help people with cognitive decline do things they otherwise wouldn't be able to do. That's one theme that came out. Most positive technology experience were with mobile phones, tablets, and smart speakers, and people really saw it as an alternative way to attend community and service venues, especially during the pandemic. So for example, things like church. And what really came out was that for a lot of the individuals, it instilled a sense of hope for the future, that this was something that could help them be successful into the future, this being technology. One other thing that came up over and over again was the use of video calls instead of phone calls to engage with people. So a quote from one of the care partners, dad doesn't really understand who the person is on the other end of the phone if he can't see them. So I usually start my iPad for him and start a video chat with his grandsons, my husband, his daughter, my sister, who's in Sydney, or my mom to say goodnight, that sort of thing, and he responds really well to that. So those types of experience were really highlighted sort of repeatedly. On the negative technology encounter side, these were consistently described with the most emotions. So people, the emotions came strongly when technology didn't work, and they were really quick to, for example, abandon technology if it didn't work. So another example from one of the interviews, the guy said, so with technology, having all this fancy stuff is helpful when it's working, but when it's not, when you just want to turn the damn lights off and they won't go off, it's a good way to get a hole in the wall. So, very clear that this is something that he just wanted to be simple, and if the technology is working, it is, and if it isn't, those negative emotions come pretty quickly. Another trend that came up, technology features as well as updates were a focus. So things like small screens, excessive buttons, needing to constantly put in a password, poor wireless connectivity, and then the one person described them as relentless updates, that every time they went to use their piece of technology, they were asked to update it. And then smart home technology specifically, it came up a lot that when they respond, when you're not trying to interact with it, it raises privacy concerns. So again, one other quote, I don't like it when she speaks to us without us asking. I just want to say, Alexa, hope you're enjoying the show. And this was an individual with cognitive decline, and any of us that have these devices have certainly had that experience. Now, neutral encounters were also highlighted, as well as non-use encounters. These were the least reported type of encounter, probably because we were asking for their experiences, but maybe the neutral encounters are less likely. These primarily would come up for technology that's become an expected or ingrained part of life. People would describe them less richly and less emotionally compared to other encounters. So for example, using a smartphone for a regular phone call. And then some non-use examples, these were highly personal and variable, so avoiding the burden of learning a new technology, no longer using technology because certain symptoms have advanced, or negative experiences, especially when they were related to updates or this feeling of lack of support drove non-use. So the last thing I want to talk through is the role of the caregiver in the above. We did involve caregivers in these conversations, and it's important to know how individuals with dementia view that. So almost universally, care partners were what made technology use successful in these individuals. For all types of encounters, positive, negative, individuals with cognitive decline would consistently discuss their care partner's involvement. So positive interactions were largely attributed to the care partner, like this is going well because my daughter taught me how to use it. Negative interactions were felt to be mitigated by care partners. If I can't figure out how to do the update, my husband does it for me. And neutral and non-use encounters were kind of, quote, not a big deal because the care partners were there. So if technology isn't going to be part of the solution, I have this person in my life who is helping to care for me, and they're largely picking up the slack and helping out with those things. Care partners were credited with selecting technology that works. So for example, realizing that you're buying the same brand of technology and that this reduces the learning curve. Another quote here, he has a really hard time figuring stuff out that's new, so I make sure we stick with the same brand. We do everything we can to make sure they don't switch it up on him, like moving the buttons. Even the same symbols can be really important. And what the care partner said was, in other words, she makes sure a Toyota stays a Toyota, meaning that it's sort of the same brand and he can understand it. Care partners were also critical for determining when it was time to move on from technology. So when technology is making things more frustrating or tense, really helping to make that decision that, hey, let's move on to a lower tech solution. It didn't really come out as a trend in the analysis, but one thing that we hear is when a care partner or somebody buys technology for an individual with cognitive decline, they feel very poorly if they're not able to figure it out. Meaning, someone bought this for me, they're trying to help me. If I'm not able to use it, that I feel bad that they made this effort and it's not working. So last quote, activity-wise, all the non-digital stuff is the most effective, like coloring and Jenga, going for a walk, anything that stimulates his senses. He prefers looking through real books and old print photos rather than staring at a screen. So the next steps for this particular project, so the manuscript is almost finalized. It's going to be submitted to one of the dementia journals. It's going to be shared with Amazon, so once we get this portion of the work done, we'll set up a call with them to talk through, what have we learned and what might next steps with them look like. The University of Queensland is already using the study responses to guide product suggestions and development. Their relationship with Amazon on this work is longer lasting and much deeper than ours. We're coming into this relatively new. And when the above is completed, the idea would be for us to put together a contract with them and pilot the work that they're doing. So concluding remarks, within a year of the pandemic starting, older adults were spending money to upgrade technology, things like smartphones, TVs, and the headsets that we talked about. But this was still not on parity with younger adults. By the end of 2023, adult primary tech ownership was now on parity with younger adults, and this use of smart home technology was lagging. In those with cognitive decline, the positive interactions with technology can instill a sense of hope for the future. And then these negative interactions, and this is really important to highlight, is that the negative interactions really seem to carry more weight and lead to these strong emotions, quick opinions. When things aren't working right, you sometimes only get a few shots to make it something that the person's going to integrate into part of their daily activities. So really that's a big driving home point that we've already communicated back to Amazon, and one thing that they are more actively looking into is sort of a potential nonprofit part of their work where they offer free one-on-one services to help individuals that meet certain parameters, older adults, to set up and use the technology that they're buying. And that's something that we were really excited to hear them say. We'll see how that ends up playing out. And then care partners are seen as a key driver of technology use by those with cognitive decline. And I asked the University of Queensland team to sort of give me a remark on what they thought the findings showed. So they said, evidentially, the technology experiences of participants were complex and varied, challenging the false assumption that people living with dementia do not use technology, as well as the societal assumption that everybody wants to use technology. And that's what I have for you guys, so thank you very much.
Matt, that was very, very interesting. Yeah, I guess there is this assumption that one might superficially have that people, as they get older or more impaired, are going to have a lot of trouble with technology and it's not going to be very useful. But as you pointed out, there's this opposite reality, at least in part, that technology has the potential to give people a sense of hope that more things are possible. Yep. than they might otherwise feel given their limitations. And so along those lines, my questions for you is, of course, you're working with Amazon and they make Alexa, and I have wondered about whether Alexa and comparable devices like that are going to do more of what we were just alluding to. That is, give people more options, give people who might be very limited, homebound, even bedbound, the ability to more easily connect with the world. And I don't know if that's one of the directions.
It absolutely is. So when we've had some of these initial discussions with them, a couple themes came out on their end. One is it worth investing the time and money if these people aren't interested? So that we heard from them. I think this work helps to show that these individuals are interested in technology. They're just interested in things that work for them. Another thing that they brought up from the beginning is they as a company have been reluctant to dive too deeply into elements of this that might be related to healthcare, meaning from a legal standpoint, if they say, hey, our devices can be used to identify when something in the house isn't going right or contact the authorities, and that doesn't go the way that it's supposed to, what is their liability? So they've made a lot of movements in that. For any of you guys that follow it, they've made a lot of purchases that they're now offering, they being Amazon Healthcare. They have a pharmacy now. They really are moving very strongly in the health tech direction, but for a long time they were pretty reluctant to do that. Probably one of the first things they did, they bought a company called, I think it was called PillPack, that sent pills out to people's homes, saw that there was a profit line there, and then have really moved into having things like urgent care clinics now. Yeah, please.
Okay. Who is that with the, yes, go ahead.
Yeah, great question. So it is a concern.
You want to repeat the question?
Oh yeah, sure. So the question was about when we're talking about privacy and security measures, there's the great possibility of scams when it comes to putting your information online or putting your credit card information. The listening, interestingly, the listening of smart home devices was more the privacy concern that people brought up. I wonder if that's because a lot of these individuals, especially those with cognitive decline, they're not setting this stuff up on their own. Somebody else is doing it. So probably somebody's aware that there's potentially credit card information stored there. But with the Alexa devices, there is an option now that you don't have to put in any of that type of stuff, but you're still giving it access to your internet. You're still putting in your internet password to give it access to all of that. It partially could be the way that we phrase the questions. I also thought we were going to hear more of that as a trend. Some of my colleagues out at Bayview are specifically looking at things like scams as it relates to older individuals with cognitive decline. How do you help protect them? It's a big, major theme. It just didn't come up in these particular focus groups, but it's definitely a major theme.
Other folks have questions? Dr. Nesta.
Hey, Paul. Yeah, great question, Paul. Yeah, so this is.
Want to repeat that one?
Yeah, so Paul's question was about what was like the socioeconomic status of the individuals that participated in the focus groups, and was there a variation in how people responded based on that? A lot of part of this was our issue with recruitment. A lot of these individuals that participated were, like Carl, highly educated, had worked very long, successful careers, and had a care partner, right? I mean, the fact that we required them to have a care partner in some ways is kind of self-selective. So we didn't see a lot of variation in the opinions of the focus groups, but also we did not have the most widely variable group of people to begin with. Most of them had had some sort of experience with these types of technology. Most of them, somebody had purchased them a smart speaker at some point. It was not overly representative of every older individual. I would expect there would be differences if we would expand something out. This was all done in a non-funded, let's get started on this work. So if something were to be funded later, we could do something that is more representative. But great question, Paul.
I think Amazon might be able to help.
Yeah.
Dr. Franklin, I hear they have some funds.
Yeah.
Dr. Franklin.
Yeah, sure. Sure there has been. Now these particular focus groups, we tried to stay away from diving too deeply into AI conversations because it's a topic all in itself, as you guys know. But I will say this example, and I hear this in my clinical work as well. Patients often describe Alexa or the Google equivalent as being present in the home. Almost, I describe it as like a sense of presence that even when, let's say, a care partner leaves, if Alexa's there with them, like somebody's there. And so it starts to show you the potential power of AI in that they actually don't feel alone, they don't feel scared. It maybe even allows their care partner to be able to go out and do the things that they need to do. And we've even had people buy smart home devices specifically for that, to try to get some more independence back for the care provider. There's lots of people that are doing that work, and it is going to be fruitful, that it's going to be a way of helping to engage and helping these individuals be successful at home.
Dr. Swartz.
Hey, Dr. Swartz. Yep. Absolutely, you are completely right. Very, very challenging. I completely agree with you. So feedback like that has gone back to them. We'll see if it creates anything, but that's where those conversations about, they were thinking about it as, can we create sort of a side nonprofit to help do that work? That might be an incredibly beneficial, low-hanging thing to do. I mean, there's all kinds of things that people try to do to keep individuals successfully in society, but if you just had a group of people focused on how do we help these individuals use this technology, it'd be worth pretty much every dollar. So maybe we can create that company, Dr. Swartz. But I mean, it's really needed. And
it'd be a wonderful thing. You'd think it would cost a lot, which means they'd have to just pass on the costs, that rather than $6.99 a month, you pay $9.99 a month to be able to access.
To be able to access it, right. But you know, credit card companies, anybody that has a nice credit card, you can call and talk to somebody right away. You can't do that with a standard credit card. So you're right. I mean, it would be something fee-based, but it's definitely possible.
Dr. Tice.
The trend that came up with, Jason's question was about password management and any concerns about security and privacy there. Jason, the big thing that came up with passwords was how annoying it was to have to re-enter it when something like, timed out or updated and you had to put it back in. That was primarily what came up. We didn't in these focus groups get that trend of, I feel like I need to make a dozen different passwords just to be safe. It was more, hey, the app updated and my son's not here to help me log back in, I'm stuck. That's more what came up. But I think the security around password management in this age group and all age groups, we don't take it seriously enough. So yeah, it's definitely an important trend. We just didn't hear it.
Okay, with that we will wrap up. That was really terrific.
Thanks, Jimmy.
Thanks, Dr.